Hi everyone, welcome to Wednesday Wisdom. So for today's episode, we are going to be looking at the jaw, we're going to be looking at the anatomy of the jaw, the main conditions, how they occur, and what you can do to prevent pain referring into this area. So the temporal mandibular joint, the TMJ, is the joint just here in the face. It is an articulation between the mandibular bone and then the temporal bone of the cranium. So there's 2 points here, and as it comes in, what we've got within the joint, which makes it so pain sensitive, is we've got a disc, an articular disc within the joint itself. What we've also got is retrodiscal tissue around the area. We've got synovial membranes as well as a capsule over the joint. So there's lots of different structures that can become sensitive with the two synovial cavities either side. What happens day to day when we speak, when we chew, when we talk, is we need the jaw to open and close. What can happen though, however, is if we've had any issues occurring around the area, it can become very, very pain sensitive. So the structures that can get involved, like I said, is there's the disc, there's the capsule, there's the synovial cavities and membranes. What we also have is ligaments attaching around this area and lots of muscles that get involved when we're moving and when we're talking. So we've got muscles around here. So we've got your masseter, which is your main muscle when we're chewing, which helps us open and close the jaw. We've got the temporalis muscles, and then we've got the muscles down in here that are blending with the mandibular bone. So there's lots of different structures that get involved. When we open and close the mouth, so the main movements of the jaw is opening and closing. Opening is typically through gravity with a little bit of involvement of the pterygoid muscle. And then when we're closing, that is where we use the big muscles. So when we're closing the jaw, we use the masseter and the temporalis to close it. What the movements are also, the other movements, that are also produced by the jaw is protraction and retraction. So forward and back. So it goes forward and back, up and down. So they are the main movements. The nerve supply that supplies the muscles around this area and the jaw itself is from the trigeminal nerve, and that is why pain around this area can give local pain but also can refer around this area. So different causes of problems, and this is where it becomes really, really key, is it's broken down into two categories. We've either got intra-articular problems or extra-articular problems. So when issues arise, it's either damage within the joint itself, so either to the disc or the ligaments or around the capsule, so that either gets inflamed, so we can get inflammation of the synovial membrane and all of the structures in here. This could be due to clenching, biting down, lots of talking. We get inflammation in here. What we can also get is internal movement through there. So again, that might be from trauma, it might be from leaning, it might be from having the mouth open, any kind of surgery or anything with the dentist where it's open can cause inflammation and soreness deep within here. How it typically presents is a deep soreness, possibly clicking, ache as we're opening and closing the jaw, or even the inability to either move the jaw properly. So it might be fixing in a position or sore when we move the actual jaw itself. Extra articular issues, so stuff outside, so externally here from the joint, is possibly issues with the muscles. So we can get spasms and tightness of the muscles. So depending on how you respond to stress, quite a lot of us, if we get very, very stressed, we lift up through the shoulders. And what we also find is we bite down with the jaw. So it's very common to get bruxism, so clenching of the jaw. If we're doing it occasionally, not so bad. So short term, we might find a little bit of soreness in here. If we repeat that over and over and over, what you can start to get is significant guarding and tightness through these areas. Not only can they give local pain here and here, but what this can also produce is almost like a vice-like tension into the head and soreness coming down into the neck as well. So when these muscles get really, really tight, that can also refer around the area. What we can also get is issues with the cervical muscles. So any of the muscles around here can also refer into the front of the face. So if we're getting any knots or trigger points in the muscle belly around this area and into the shoulder, what can typically happen with a trigger point is it's either latent where the pain stays local, or it can become active if it's been tight for a long period of time. And again, that can refer up. What we can also get, which can trigger jaw pain, so lots of different stuff that can cause it today, is capsular issues within the neck. So within the joints, within the facet joints of the neck, they're surrounded by a capsule. that specific pattern for the capsule can vary, but typically higher up in the neck, C2-3, the capsule typically can refer around into the jaw and then up into the back of the head. So any locking of the neck or any pressure through the neck or soreness that we find here can also refer into the face. So we could feel like, oh, it might be my jaw. And actually on assessment, we want to look right the way around just to see if any of that are triggering the pain and symptoms. What also happens if we're thinking of poor posture is if the head's dropping forward, and so we've got that anterior head carry, so if I do it from the side, so kind of forward like this, what we find is we're sat at our desk, or if we're looking down at our phones, everything's dropping forward. What typically happens is the anterior belly of the digastric muscle, which is coming round, it tightens, so people can feel tightness around here. What it does, it puts a posterior force, so a force back into the mandibular bone here, which then puts pressure into the joint itself. So if we're doing this a lot over time, if we're clenching down and we're dropping the head forward, this can cause a lot of pressure to form around the area. So what do you do about it? What can you do? So if obviously there's anything going on inside the joint itself, I would always recommend seeing a specialist for that, so orthopedic specialist, because if there is any damage to the actual disc, or it's clicking or it's locking in a position, you need someone to investigate what's going on. So any intra-articular issues, that is something that I would have a look at with a specialist. If it's extra-articular, i.e. referral into the area, or a lot of tightness around here and here, that is something we as osteopaths can deal with. So we would look at the mechanics, so how's your neck moving, tightness around the area, so releasing through, releasing around here and draining up through the head, and then possibly any adjustments if relevant, if any of the joints have locked up through here. Some of the other stuff we would advise treatment-wise and rehab-wise is getting you to start to soften through the main muscles around the face and the main muscles for chewing and talking and movement of the jaw. So again, I'll attach a video that we've made already on Bruxism, which we just absolutely love, that shows that relaxation around the head and the face and into the jaw. What we would also want you to do is obviously stretching through the neck. So really obvious stuff that we've covered, but just good to kind of relate with the jaw, is stretching into the neck, you know, massage around the neck, movement through the neck and making sure you're retracting the head back so we're not putting pressure through, and then obviously setting your workplace up for success. So having a look to see how can you change your mechanics when you're working, how can you stop yourself slumping and stop the pressure forming around here, and then obviously looking at what's causing your stress. So it might mean that actually if we can get to the root of the problem and we can look at your stress levels, that will also help how you're holding yourself in your jaw. So maybe meditation, any variables that's causing stress, take them out of your life or reduce them. Anything that's causing high levels of stress, that will also help as well. And then finding what we'd look at is if we've done all of that and it's still causing problems, possibly referring over to the dentist as well, because any dental issues too can be referring into the jaw and into the teeth as well. So that can all become very, very sensitive. So it's working out what's going on, who's the best person for you to see, which again might mean kind of popping and getting it assessed and also us referring on, or seeing if we can work around the local area to get it feeling better and less sore. So hopefully really helpful today. Love talking about the jaw because I feel like it's just such an intricate area. I feel like there's lots of stuff to cover, lots of stuff that overlaps with the jaw. So hopefully that was helpful. Any questions, let me know, comment below. I'll attach our Bruxism video just to release around the area. And obviously any other topics that you want me to cover, just comment underneath the video.